Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hey, everybody, it's Vet Tales again.
Hi, everybody. It's Josiah Dame, Dr. Josiah Dame,
as we like to call him.
Yeah.
And Dr. Natalie Keith. And we're going to jump off into maybe one of our shortest episodes of Vet Tales.
Yeah, this is a very specific, listen, we've hit a lot. It's been a year since we've been doing podcasts. We've hit a lot of like the more normal, common things. And so when we have some weird things come through the clinic, it sparks interest in me. And I may want to talk about a more niche or less common disease. And so we're going to do that today for fun, because it's fun to learn. And then it's also the first week of school. So it's a hectic week.
Yeah, it's a hectic week for the clients scurrying about. But here it's actually pretty quiet.
It's pretty quiet here.
Yeah.
But at home and for clients, I'm sure it's a hectic week, which is probably why it's a little quiet here.
Exactly.
But we are going to be talking about insulinomas today, mainly in dogs, but cats can get them. And then our exotic friends, the ones that like to get them, are ferrets.
Ferrets love insulinomas.
They do. It
is common for them. Ferrets are not common.
Yeah, ferrets aren't common here for us necessarily, but insulinomas are extremely common in ferrets. It's one of the top 2 cancers that I expect them basically to get by the time they're the age of 5 or 6, because almost all ferrets are Marshall Farm ferrets, which if y'all look into that, and basically the US, all their ferrets that you get from like any pet store is going to be from Marshall Farms, because, you know, there's a lot of control on like, you don't want a wild ferret out there. So there's not many people who breed ferrets.
Yeah.
Is it even legal in the US to breed ferrets?
I don't know.
I don't know either.
I just know that nobody, nobody does.
No one breeds ferrets. But there are people who get ferrets from like other countries that are not Marshall Farm ferrets.
And they don't tend to have insulinomas.
Yes.
We're not making like any kind of like...
No, they teach you that in school.
Yeah, they do.
Yeah, it's because Marshall Farm ferrets, they all have pretty similar genetic lineage. So a lot of them end up getting the same diseases at the age 5 or 6. And so it stinks because they're wonderful pets. But on the medical side, when they're 5 or 6, I know, okay, these are the 2 things I'm looking for, which is not a good thing. But I'm saying it is nice sometimes for the client, because we typically can get to an answer quickly. So
that's true.
Yeah.
Yeah. And the symptoms are so much different.
Yes, they are.
So anyway.
So insulinoma.
Yeah. You kind of dropped in there that it was one of the 2 kinds of cancers.
Yeah.
You know? So it is a cancer.
It is a cancer. Quick question, Dr. Keith.
Uh-oh.
How often do you see insulinomas?
So I would say I've been in as a veterinarian on my 15th year, I believe. Yeah. And I've had 2.
Yeah. This last month, y'all, I've had 2.
Yeah, right? Isn't that wild?
It's wild. And I did not necessarily enjoy it because it's not fun for the owner or for the pet or for the doctor. So anytime that we have a patient coming in having seizures, we've done the seizure talk before. We have said this before, we do lab work. And the reason being is because you got to catch certain things. Are the liver values elevated? Are the kidney values elevated? Is the glucose below 60?
Yeah.
And recently I've had 2 pets who have last month who are having seizures. I did the lab work and lo and behold, the glucose is below 60.
Right. Which is totally different mechanism of action than if you have, let's say, a 10-week-old Yorkie puppy that's 3 pounds. So you got hypoglycemia from a whole different thing, and it has nothing to do with their pancreas or any of that.
That just has to do with them being a baby.
As a baby. They have brown fat and they don't keep their blood sugar up, like the host said. And sometimes their livers are weird.
Yeah. These are my patients. They were 7 to 13 years old. So older patients, low glucose, owners aren't on insulin. The dogs aren't on insulin. So they weren't getting, accidentally overdosed with a medication. So then you go, okay, was that just random? Or is that real? And so you do a spot glucose check. Okay, it's real. And then you start to talk to the owner and say, hey, here are the next steps. First, we have to assess the patient. So in these situations, the patient could be in a complete crisis mode and just like seizure, or they could be fine.
I know.
Which is terrifying.
Yeah. Because you could just be missing it.
Yeah. And because the body manages.
Uh-huh.
And they can manage for months.
Yep.
And so one of my insulinoma patients who is still with us has a seizure about every 8 months. And that's been going on for about 2 years. So that tells me we've probably had this insulinoma for about 2 years. And it might just be a more slow growing one, but a little terrifying nonetheless. But once you get these patients, you realize, okay, there's probably an insulinoma. You do your just baseline lab work. You're going to check for Addison's to make sure it's not Addison's.
Yeah, that happened to me recently, actually, where I really thought I had an insulinoma and it ended up being an atypical Addison's.
Which is always, we've talked, again, go back to that Addisonian lecture that we did in the discussion.
Hair pulling.
Because that, when it's atypical, it's stressful and it's tough. And so the Addison's test may come back normal. And then you go, all right, here we go.
Yeah.
Because...
So... Do you want to, like, maybe you're getting there, but, like, do you want to describe what the insulinoma is actually doing?
Yeah. I'm mad at myself. So, insulinoma is going to be, well, first off, let's talk about pancreas.
All right, back her on up.
Like,
the anatomy.
Back up. I gave you all the case description. We're seeing our older dog who is having seizures and has low glucose. So, back to anatomy, the pancreas.
Yeah.
The pancreas is awesome. It's our little organ friend who likes to lay next to or should better be between the stomach and the upper portion of your small intestine.
Yeah, the duodenum.
It kind of lays there over those two. The pancreas is very important. It secretes insulin. It secretes digestive enzymes, so things to break down your food. And it also, when it gets mad, will develop into pancreatitis.
Yes, which I thought we have an episode on pancreatitis. If we don't...
I just thought, I don't think we do.
Okay,
that's the next one, guys, because we got a lot to talk about.
The pancreas is a wild little organ, and it's funny because it's very like non-structural. It's like, it looks like just this pink, floofy, squishy bits of like, it's not...
Every time I look at it, I go, don't touch it.
If you touch it, it makes it mad.
Yeah, it's like a fragile friend.
It is very fragile.
And you don't want to touch it because you will make it mad and you don't want to induce, pancreatitis. And then you talk to some like surgeons and internal med specialists. Like I've talked to one internal med specialist. He's like, don't be afraid.
No, be afraid.
And I'm like, I'm afraid.
Yeah. So the internal medicine team. Yeah. So anyway, the pancreas, it's in there it's floofy, non-superstructural cell doing all of these things to secreting the digestive enzymes. So if that doesn't work, you end up with like EPI, which is another thing we could talk about soon, or exocrine pancreatic insufficiency. Mm-hmm. If it's not doing its job with the secretion of the insulin in general, now we have diabetes. Mm-hmm. But this is a whole different thing.
Different. So when the pancreas goes wrong, it goes wrong.
Yeah.
It is like catastrophic. So if anything's important, it's the pancreas. And when it gets mad, it makes other things mad. So like the inflammation of the pancreas is the inflammation of so many other things.
Triaditis.
Because it's where it's nestled in.
Yeah, well, and it's secreting these digestive enzymes on like overdrive, and those are like, it's like leaking acid basically into the abdomen, and it's like, ouch. So the liver's mad, the stomach's mad.
Love your pancreas.
Be nice to your pancreas.
And be nice to your pancreas.
Tell it thank you.
Tell it to never get any issues.
Yeah.
So insulinoma is going to be a tumor that develops on the pancreas. Technically, it could be elsewhere too. You can technically get this, but we're not going to get it. And it's going to be a tumor of the cells that make insulin. The fact that our bodies work in general,
it's just mind-blowing.
Just mind-blowing. Dog, cat, human, like insane.
Yeah. We
should not be functioning.
Right.
Like there's a book that I love that's basically about like it's an ND book. Like it's written by
Doctor. I remember you.
And she wrote this book about being kind of like having empathy for the patient and like knowing their whole story, because their whole story matters. They're not just like
science tests
or just something walking in with like a problem, which I feel like veterinarians don't have as much trouble with, because we have to have a very special relationship with the animal because they can't tell us what they're feeling. So we have to like hand tune with them a little bit. But she has a statement in there. It's like, or she's quoting somebody else, but if you're in charge of your liver for 24 hours, you would be dead with that's 5.
Yeah, or something like that. It's like, yeah, if you were in charge of your liver, you'd be dead in 24 hours. That was you sent it to me one day.
That's just a good one. So I never want to be in charge of my pancreas, because if I go to Brahms and I eat a big bowl of ice cream and I have the sugar spike, my pancreas is going to, and I have higher levels of glucose, my pancreas is going to release insulin and keep me in a good range if I'm not diabetic.
You're right.
So it'll bring me down to a good glucose level, and I will maintain, an appropriate level of glucose. Then you have an insulinoma that responds inappropriately and is just pumping out insulin.
Right. In the absence of necessarily intaking any sugar.
Exactly. And so you get these dogs who are ratting in the 50s, 60s, which is actually not going to probably cause issues until they drop to like 30. And then they're going to have seizures, and then they're going to go into a comatose state.
Because essentially insulin is taking blood sugar out of the blood into tissues, and you have to have a certain amount of blood sugar in your blood to maintain consciousness.
Exactly. And so circling back around, because I did get ahead of myself, we find that we have low blood glucose. We do the Addisonians test. That's normal. All right. So then I have the big, expensive conversation with companies.
God. And time consuming.
We will obviously do as many tests here as we possibly can. Always stamp that onto my forehead.
I mean, some of them are sent out, we draw the blood, we send it out to an outside lab, but we're still doing it. So the patient never has to go anywhere else.
Yes. And so I will ultrasound these patients, these dogs, and I will look at the pancreas and see if I can see an obvious tumor.
Sometimes insulinomas, though, are not, the cells are scattered.
Yes.
So even the best ultrasonographer would be like, this looks great. And it's not.
Yeah. You can't guarantee a diagnosis on ultrasound. So if I do the ultrasound and I say, I'm so sorry, I don't see anything, the next kind of step is advanced imaging. So that's going to be a CT most likely in our area. And I'm going to refer for a CT to see if we can find it. And that's if we are very gung-ho about potentially the surgical avenue, which we'll get to. But I will say, hey, the only way we may find this tumor is to go ahead and do a CT. Then, while we are, considering a CT, there's a test that takes almost 2 weeks to get results back.
It's so crazy. It's a blood test. And it takes almost 2, I don't understand it.
Yeah. So one way to kind of confirm, in quotations, you're not confirming it because you're not finding it, but you are increasing the likelihood that this is an insulinoma, is sending off an insulin glucose ratio test. It has to go to a university, I believe it's Michigan, and they check the insulin levels and you compare it. And so essentially, if your blood glucose is below 60 and your insulin is high, you have an insulinoma. And so I've had patients who have gone and got the CT and have found the tumor and then have discussed prognosis, with the specialist that did the CT and have made the decision to euthanize. And then I have another patient who, declined CT, which is fine.
Most people do. Yeah. And there's no judgment here.
There's no judgment.
We're just recommending all the options so you have the information to make the best decision for you.
Exactly. And so, I'd like to bring up those patients that we're talking about, the one that got the CT versus the one that, recently declined, the age difference was huge. So one of them was a much younger dog. One of them is a much older dog. And so we are here to support you at whatever direction you go. And so we didn't do the CT, but we sent off the insulin glucose ratio. It's totally skewed, completely supportive of an insulinoma. And so I then said, hey, do you want to go do imaging? No. Okay, great. So now we kind of talk about treatment. For a patient who went and got imaging, surgery is an option for insulinomas. They can go in and remove them. The problem is, most of the time, by the time you're finding them, they've seeded, they've spread. And so you'll get a good time of quiescence where you're not having clinical disease, but then it'll typically come back, be that in the pancreas or if it's seeded somewhere else in the body, because that is also a potential. And so that's disheartening, of course. I recently, for my patient that didn't go get a CT, I spoke to an internal med specialist about them once I got the results back. And I was like, hey, I have a client who's not interested in surgery. This is an older dog. What are our options? And she kind of gave me 3 tiers, which is awesome because I like to give people as many options as possible because I don't know what is best for them in their current situation. So number 1, we're going to recommend referral just to an oncologist because that is something that is gold standard. And so I offered that to that owner. Secondly, recently, I guess a lot of, which is not in like any of the things I've read because it seems a little bit more new, a lot of doctors are using Palladia, which is a oral chemotherapy that we actually can get here. The downside of Palladia is when these dogs are 60, 70, 80 pounds.
It's pricey.
It's so pricey, y'all.
Yeah.
So,
originally it was for mast cell tumors, yeah? Yeah.
It's for mast cell tumors, but I guess they're using it a little bit in insulinomas and they've seen some effect or some helpfulness to it. Again, you're going to get a period of probably it working and then you're going to get a period of it not.
Yeah, like the point where it becomes no longer effective.
Exactly. And then the kind of third option was frequent meals and a steroid.
Yeah, and like being on point with options for like supplementing the sugar if you do have a seizure, like getting sugar water or Karo syrup, something like that down them to try to stabilize.
Exactly.
And then at some point, it seems like
quality of life discussion and saying, hey, like this is now kind of out of hand. We're not getting the best control on it anymore. So, talking about here are the next steps. Like we probably need to discuss euthanasia because it might not be responding to that steroid helping stabilize them or just a simple 6 meals a day instead of the 2 that people are on, like the dogs. There are some kind of specific medications, which were not mentioned by the internal med specialists, but they're mentioned in other literature. So streptozocin, which targets the actual cells that secrete the insulin. But it can cause kidney failure, so it to be on like IV fluids when they're doing this. And then other kind of like chemotherapy drugs. So topanib, which I'm pretty sure is Palladia. Doxorubicin, which is something we use commonly. I think it's a lymphoma chemotherapy. And aloxin are the kind of the chemotherapy drugs. But that's kind of my rundown. My patient, so like I said, I had one that was younger that went to got a CT done. That patient was having a lot of seizures and was not really able to get stabilized. And when they found the tumor, it was large and they just opted for euthanasia, which was the best thing for that patient.
Right.
Because there was probably not a way that they were going to stabilize them. And the other patient that, we found it maybe a little bit, not early because it's been there for a while, but we're not in those like active seizure events, just occasional. We're doing very well. We're acting completely normal. And we have the frequent meals and the steroids.
Yeah. A lot of it just depends on how aggressive it is and how big it is and how big the patient is. And so many other variables going into it. And I bet you, just as a thought in my head, is probably the reason the internal medicine doctor did not mention those drugs is because you probably have to be with an oncologist to do most of those. I think some of it, the Palladia, obviously we can use, but a lot of that stuff, you have to be a board certified oncologist. And there's not a ton of those that exist in veterinary medicine.
No, the closest board certified is going to be Dallas. The ones in Dallas that I have the most experience with are at Animal Diagnostic Clinic, which are in North Dallas. They're awesome.
We used to have one in the city, but that didn't last long.
Yeah. So ADC in Dallas is where I send most of my people because I do know those doctors. I've worked with them for pretty often and they are nothing but helpful. And never hesitate to just be like, can you just talk to an oncologist? Yeah, I can. Yeah.
They will. They're pretty good about just like having a conversation at least to give us some basic guidance on our options.
Exactly. Which is why, for these things that's, insulinomas are not common. I've found internal med specialists because I was like, hey, like I've gotten to this point. My client doesn't necessarily want to go any further, which is fine. I feel like I need to tell y'all every time it's fine. Give me some advice. And, they do, and they give you really great options. So a lot of ways to treat or to manage, I should say, these patients. But those are the kind of the big ones. Next time we'll talk about pancreatitis.
Yeah, I can't
We'll double check. But
believe. Yeah, I'm going to look back through the playlist, but I really feel like I don't recall doing it, which is nuts because we treat those dogs like every 5 seconds.
maybe we did.
Maybe.
But there is a new drug.
Yeah, I was going to say, I don't think we would have talked about it since the new medication.
Yeah.
So
we need to,
the Panaquil.
because there's a great new product called Panaquil.
Yeah. Cool. All right. Well, 21 minutes.
Oh. Ferrets. Most of the time, people don't want to refer for ferrets because obviously we're going to offer a referral. They also just pretty much get steroids. That was the last thing I wanted.
Yeah.
We basically just start them on steroids and then manage them until.
And keep the frequent meals and sugar going on and stuff like that. So, yep. So that's interesting. What's the other cancer? Is it adenocarcinoma?
Adenocarcinoma and insulinoma.
Yeah.
Be the top two.
Yeah.
And then, because the adenocarcinoma will.
It's like Cushing's?
Yes. They basically develop like a cushion-oid kind of appearance.
Yeah.
Yeah.
Ferrets. I do love ferrets. They do smell quite bad.
I love.
They're really cool animals. They just smell
fun.
I just wouldn't want to live with one in my house because of the musky smell.
But if I have the opportunity to play with one,
I am all
in a big room. So.
Or when I can wash my hands.
Yeah, one of my favorite things about working at the Oklahoma City Studio that educate as a junior curator, which is a program they have that's phenomenal in high school. They had 5 ferrets in the education department, and we would just release them into one of the big classrooms, and they would just hop around and run. They're so funny.
They are funny. They're really entertaining little creatures. It's like a cat and a squirrel had a baby.
Yeah.
Anyway, all right, okay. Well, that's enough about insulinomas. Next time, pancreatitis, and we'll see y'all then.
Yeah.
All right, bye.